Cool, thank you. Yeah.
I think hospitals are major economic drivers for a lot of communities, and so we want to make sure that those hospitals stay intact, stay whole, continue to be the economic driver, keep jobs for the people in those communities, especially in the rural communities like you're talking about, the critical access hospitals. Typically, they're probably the largest employer, you know, or they're 1 and 2 with the schools and municipalities, and so those.
I keep thinking about this pie we have, and
I know.
It's sliced all up, and we give somebody a little more. That means we got to take it from somebody else who gets a mission.
We have no money, and we have to start creating jobs, and we have to make sure we do what's right, especially in terms of healthcare. So we're doing everything we possibly can. I want to encourage everyone in this room, and I don't want to dominate here, but please let us know what you're thinking, and let your senators, whomever they may be, know that too. Call them on the phone, have coffee with them. This is incredibly important. I gotta give you credit. This is one of the largest groups I've seen in terms of advocacy in the past few months. I give you a lot of credit for that. That's fantastic. I mean, it's great. So this has an impact, and we're going to take this to a caucus today and also talk about it. I just want to thank you for being here, because that is important. But don't forget to call us at home too.
One of the things I would like to say is that, you know, I'm a freshman here, I'm brand new at this, and I think I've heard about every problem that there is. But what I haven't heard too much is where the solutions are at. So if anybody has solutions, ways that we can make this thing better and get through this, and we're all ears. We need solutions, not just complaints.
As you all know, Medicaid is the largest single part of the budget. It's also growing faster than the other part of the budget, which is why it's taking up the largest single increase in the budget. That said, to healthcare, as everybody knows, healthcare is very, very, very important, and 1 in 5 people do get Medicaid services in this state, and we have to be very careful about changing it.
The entire health department, I really believe that they have the best interests of our citizens at stake, as you do. I know as hospital directors and hospital personnel, you are there for your patients. You're not there for any other reason. Just like I know the teachers are there for the children. They really are. Almost everybody in your profession is there for the right reason, and that is for the health of the community. And I believe that just a timeout for a while, and let us look at these programs very critically and demand that the right people are getting the right care with the right dollars. And let's fund them in a way that we can go into the future in a positive change direction. So I think with all responsibility, let's make healthcare an available option to as many as we possibly can in a great environment. I mean, the Chippewa Valley is an unbelievable environment in which to get ill. I mean, you've got great facilities, you've got great personnel, you've got probably the best in the Midwest. I mean, I would rather live where I do, and close to Sacred Heart, and close to St. Joseph's, and close to Luther Hospital than anywhere in the world. I mean, we have incredible doctors and nurses. And so I'm very happy to be where I am. I don't feel I have a right to health care. I would love to have it more affordable for everyone. I guess that's where I have to end that discussion. Otherwise, I'm going into philosophies and that.
It's going to take a lot of people sitting down and working through with patience and perseverance to figure it out. And it won't end, you know, it's going to be a process. And we'll, you know, next year when we come together on this day, we won't be like, hey, we did it.
It's the 10-year
It's
plan or
a
the 20-year
continual
plan.
How's the experience?
Very good.
Good.
Wonderful, wonderful.
Your experience?
We learned a lot.
Oh, great.
Very good. Very
It's just wonderful.
It was
what
more
an
than I ever
experience.
expected.
Isn't that
That's
just
fantastic.
Very engaging, very enlightening, very educational.
Yes.
So, great discussions. Great discussions.
Great.
And kind of wish, I think we were missing 1 or 2 reps, but overall, I think it was a great experience. And for first timers like me, I would definitely come again.